Hi, I'm Dr. Gaganpreet Gill, a pediatric physiotherapist. I'm here to share about child development, milestones, and much more. So, if you like my channel Connecting Milestones, please do subscribe, like, and share with your friends. Hello, everyone. Hope you are doing good. So, in continuation with the normal development, I will be doing 0 to 1 month, the oral motor and the respiratory part, and some reflexes. So, one of the reflexes are startle reflex, in which if there is a sudden loud noise, you must have seen your kids doing suddenly getting scared. And in startle reflex, what they do is they bring their hands and legs closer, like just like this. They get when there is a loud noise and they get scared. You can see an exaggerated startle reflex in this picture. Then there is moro reflex. In this, when they feel that the support under their head or under their body is gone, they get scared. And in moro reflex, generally the hands go away from the body, like this. Like if you might see your pediatrician also checking this reflex in your baby. You would have observed when you are having a dream in which you are suddenly falling, then also you get scared in the dream, in your sleep itself. So, adding this to the previous talk, the swaddling helps them to overcome this and the sideline, because when they are on their back, then they feel suddenly unsupported and they might elicit the moro reflex. And in swaddling also, because the body is already closer, that support system they feel already with it, so this reflex might not be elicited, which can, if elicited, the child might cry, just might get scared. Then there is rooting reflex. So rooting reflex is basically if you touch finger anywhere around the mouth, they will turn their head towards that side. This is for feeding. So if the mothers, they are, even when they are near a breast of mother, even over the clothes, they can smell, and then they, on touching, they turn their head towards that side. As you can see in this picture, the baby turning the mouth, the face, the jaw on touching. Then there is swallow reflex. So it starts developing around 26 to 29 weeks in gestation, and generally completed by 34-36 weeks. So in preemies, the premature kids, sometimes that's why the sucking and swallow is not very good. So suck swallow reflex, you'll see, which is also called as true suck. You put the finger inside the child's mouth, they'll suck with their lips, and if you try to retract it out, they'll try to keep it inside. And you can also see, if you put something sweet on your finger, then they'll suck it. If it is salty, then they'll push it out with their tongue. Initially, there is a true suck in which the child is using the lips to suck easily. But gradually, when head extension, the neck starts going up, then child starts using the lips actively. At that time, because the lips are still not very active, they use their tongue more for sucking, which is called suckling actually. And the tongue moves up and down along with the jaw. So if the jaw movement is restricted, for example, child is too much in flexion while having the milk, then the jaw movement down, because imagine if my neck is like this, I won't be able to move my jaw that freely. So at that time, sucking might get affected. So the positioning at that time is important. Positioning, as can be seen in the picture, with proper latching around the areola and the nipple, and with head into mild extension. Extension means a little backwards. Then after a while, then sucking starts later on after suckling, when this oral musculature becomes more strong and they are able to hold with their lips better. In suckling, you might see that the milk also droops from the sides. Initially, in a newborn, the tongue is very short and broad, and it occupies most of the space of the mouth. In resting period, you yourself can observe your tongue. It's usually resting upwards. Why? It is very important for the tongue to rest upwards, because the palate up is initially U-shaped and very narrow, and it has grooves also, which helps in sucking. But later on, it becomes flat and a little broader with the shape of tongue. So if the tongue of the child is not resting up in rest, the shape of the palate won't be there, which is later important for breathing, for swallowing, for feeding, and so many things. You can see the tongue resting up in this picture of the child. Sometimes even the fascia of the tongue is tight here. So what you can do is you can release this fascia gradually, like if the child is lying like this, you can release it from here like this. The child slowly with a gentle pressure, that will help the tongue movement more. You can do it on daily basis for maybe few minutes. Then another thing which you can do is activate the oral area. You can use your own finger and go inside the mouth, stimulate those gums a little, like just deep pressure on the gums, on gums up, down, and the teeth are of course not there. So you can go on the jaw area also to stimulate. That will help them to become more aware of their oral structures and in sucking and feeding. In some of the kids, if feeding is a problem, then you can observe that the tongue is not tied below. So tongue stays there and the movement of tongue becomes restricted. You can talk to your pediatrician. Sometimes it requires surgery, sometimes it doesn't. Sometimes kids overcome. With the tongue tie also, the speech, phonation, and even the feeding is normal. This is one of the picture of tongue tie. It can be less also, or it can be more also. You just consult your pediatrician. Sometimes in some of the kids, the lips are also tight, which doesn't let them shape around the areola or around the nipple properly. So you can give a little release around the lips, going like this, in a gentle way, and then release these lips from here so that sucking becomes easier for them. Now the positions for feeding. There is cradle position, cross cradle position, football hold, laid back position, sideline position, and there might be more positions. You see what is comfortable for you. The things to observe is if you feel the child is coughing after the feed or not able to breathe properly, or maybe burping is not coming properly, or if they are spitting a lot of milk out, then you need to observe if the feeding position is correct or not. If the neck is too much into extension, if my neck goes like this, my tongue also goes below because my tongue is tied here. So it becomes difficult for me to use my tongue, and even jaw movement becomes a little difficult. So same way, just observe if your child is taking neck more back, and as I said, if it goes more ahead also. Those things need to be observed. When you are feeding them in the sideline, then take care to keep a hand or something under the head so that it doesn't go more down, and the milk doesn't go into the trachea instead of esophagus. So for respiration, the rib cage initially is high here, and this also restrict a little jaw movement. If, for example, the child is in lying position, because the rib cage being high, it comes up here, and this movement becomes difficult. The rib cage remains high a little. It is cylindrical, and gradually, when these muscles start working, the rib cage descends down lower. So rib cage is another important thing. Just take care if the rib cage is gradually coming down or not, or if it is too restricting for the child going up. You can give a little support, keep them in inclined plane. And for some of our kids, newborns or atypical kids, the rib cage is very important part. Starting from the first day itself, we have to take care of the rib cage. As you can see, this is rib cage of the newborn. A newborn child can suck, swallow, breathe at the same time, and gradually that coordination develops. And you just keep a check if that coordination is there or not, if they are sucking and swallowing and breathing properly or not. If it is not in coordination, there are chances that milk might go into the trachea, that there are lung infections and frequent cold and cough. So that you have to take care. Now the newborns in this age are belly breathers. When they inhale, the belly comes out, and when they exhale, it goes down. And diaphragm also stays a little up. Why all this is important is because chest plays, or respiration also plays a big role in the phonation, in the speech production. In this age, though, the child basically communicates with you through crying or maybe some friction or click movements you might hear, but the receptive language already starts developing. So receptive is able to understand it, expressive is when they are telling you. So the receptive language already is started developing. They understand their mother. So even if you think that the child is so small, can they understand? Yes, they can understand with it in the first month itself. So just take care of the feeding part, the phonation, the respiration, and the preemies, the mothers of the preemies might face more difficult times regarding the feeding or the sucking and the swallowing. You can reach out to me, you can DM me if you are having any questions regarding that. Taking care of the respiration, taking care of the breathing part, and most importantly, taking care of yourself. So DM me. I have also started my page on Facebook. If there are some mothers who might feel that they don't have Instagram accessible, they can reach me on Facebook also. So yeah, I'm there for you to help you out, and thank you. Have a nice day.